Hip politics, baby.
In 3, 2, 1. Welcome back, Hip Politics podcast listeners, audio, visual, social media, and wherever else you're listening to. It's your host, your boy, Mr. Cameron Calvin, Hip Politics founder and podcast co-host. It's another special edition of Clarifying Corona Part 2. I had a bunch of other podcasts where we just did our huge live audience one, America Vote Summit. I was trying to put the video out for that. Just went to Memphis. I had some stuff from South Carolina and Vegas. Bump all that. Only thing people are caring about right now is this corona outbreak. It's a response like the country has never seen, which, at least in my lifetime, in probably a couple generations, not since like big time wartime. This is something that's captivating everybody across the country, no matter what corner you're living in, and it's requiring you to what's the word I'm looking for? It's requiring you as American people to change your daily routine. Hopefully, it's getting people to practice more hygiene, but it's shutting down bars, having massive economic impact across several different business sectors. It's hurting people hourly wages to people with salaries. It's hurting, and then it's also putting a strain on our school system, our kids, all the different kids that have to be home now. Their parents need to be at childcare when they didn't normally have to provide for that. Had to get meals. It's different governments and people responding differently. And then on top of all that, how do I even know if I got the coronavirus? Like, I can't get a test. I'm told not to, unless I'm really having symptoms, to go to a hospital. I want to stay safe. That's what most people, at the end of the day, all that other stuff can be replaced as long as you got your life and your health. And so in an effort to stay healthy, in an effort to stay informed, in an effort to dispel some of these myths, we had Dr. Adana Llanos, an epidemiologist. She's assistant professor of epidemiology at Rutgers University, and also a Howard University alumni as well. And then I had to call on, so she gave us if you go back and watch or listen to, I put that up. We did it yesterday morning, Saturday, like right in the first, I would say, major weekend of the outbreak in America. We put that up right away, so it's there. People are already giving a lot of feedback, saying thanks and sharing it around. So go see that to hear more of around Corona, COVID-19, the illness, like the epidemiology, the background of that. What are some things? How have we seen stuff like this before? But there's the healthcare, the personal side. Like, all right, that's great. Thanks for giving me the science. Give me the practical. Like, what can I do? What am I supposed to do? What should I actually know? What's fact from fiction? I can't even get in contact with a doctor or my doctor, let alone any doctor right now that are working to get answers. I might have symptoms. What am I supposed to do? I'm scared. Am I being a hypochondriac thinking these are symptoms? These are all very normal questions that people are asking. And I wanted to bring in, if you don't know, part of my background, I actually wanted to be a doctor first. So I actually did 2 years medical school at Temple University before I found my calling into communications and marketing and got into that. But so I learned a lot of basic science, but I am far from a doctor. But the advantage is I got some really lifelong friends who are some of the best doctors in America now. And that's who I called on to get Dr. Llanos, was a connect through, who our guest is today, the super duper busy and one of the best, I think one of the DMV's top docs. We have Dr. Tiffany Turner on today. Welcome to the Hip Politics Podcast. Hi, Tiffany. Or hi, Dr. Turner. Sorry.
Thank you.
I call if you hear me interchangeably, I'm hoping you guys are hearing this audio right, because this is the first time I'm doing this through a phone without doing it through our mics. So just trying to try something different. Like, you'll have some version of this out. We're recording the video, so we'll pump this out on social. Facebook and everything. Make sure you guys are subscribing to the YouTube channel, Hip Politics Podcast. We also started Hip Politics News channel as well, so subscribe to both. We're on Instagram and Twitter, Hip Politics Podcast. In addition to that, you can follow me at Mr. Ken Calvin. I'm just trying to get this information out. As if the little bit that I can help in this information warfare of media, I'm just trying to get some accurate, non-biased information out. And that's why I had to call who's one of my good friends. We had a very unique bonding experience that very few people will ever have in this world. We shared a cadaver. So we cut up our first dead body and dissected hers. Tiffany did way better in that class than me. I had to go back. But yes, so that's what. Even then, that's why I knew, like, oh, these are surgeon hands. This is what she's meant to do. I had 0.0% patience for damn anything. What was her name? Earl? Ruth? What was it? Ruth?
Oh my God, no.
It was like an older lady.
It was.
I think it was Ruth.
Maybe.
It felt like her name.
I'm trying to think of it. As soon as
it was
finish,
something like that. It was like anime. It was like Ruth. It was like an old school
anime.
It wasn't anime, but it was like something Edith or something like that.
Yes, but exactly.
So we go back. We go way back. That's we're coming up on easily close to 14, 15 years ago. But Tiffany has gone on to be an amazing doctor. Where did you?
I was interested in surgery, and I did a year of general surgery residency, but I ended up in internal medicine. That was my true calling, and I love it.
And in addition to that, you're also on the cutting edge of the new way and what people say is not only the present, but definitely the future of medicine and medical health, which is telemedicine, which for people, I'll let you kind of dive into that initially real quick, but you are a physician partner with RoweDocs, which was founded by another one of our classmates who's amazing businesswoman and Dr. Letitia Rowe. So you're one of the physician partners of RoweDocs. Can you just briefly explain what telemedicine is?
Absolutely. So, I mean, telemedicine is something that's been practiced for many years, right? So when people call their doctor and they ask for prescriptions, they describe their symptoms and get advice from the doctor, that is telemedicine. And in the past, that was done by phone, but with technology now, we're doing that via video chats. So you can see the doctor, tell them what's happening with you. We're able to get some objective information, even with your phone. You can check your heart rate, you can check your oxygen levels, all these things. And then we can prescribe medicines for you. We can guide you to a specialist if you need that, and basically provide the same medical advice that you could have gotten in person. And that's usually for urgent care issues and even for some chronic medical issues.
Yeah, that sounds like that's something we all could use right now.
Yeah.
Because we're told not to leave our house. We're all scared to get in contact with people. Medicine, like the healthcare systems, we're told is going to be overrun or there's too much going on. So I think you tell them, am I wrong? Like, is that, no. I guess to jump right into it, is like telemedicine, is that one of the ways that you would suggest people might connect to doctors or their doctor?
So absolutely. I mean, the CDC is actually recommending that people, one, call their own doctor to get advice, but two, if you feel like you need to be seen and evaluated, they're recommending that you use telemedicine. And ultimately, we're able to screen you, ask about your symptoms, and determine if you need testing, because if you go in for testing, you are putting yourself at risk, right? Because you're putting yourself in a location where other people have similar respiratory symptoms or fever or whatever it is. So you really only want to go to an ER, urgent care, testing center, whatever it is, if you have to. So if you could get that initial screening online, I would advise it, and so does the CDC.
In this wake, though, we're hearing so much about, I need to get a coronavirus test. I need to test for COVID-19. Obviously, I can't get the test online or telemedicine. So what is the advantage of me whether I have symptoms or not, just to know if I have it. What are the advantage? I think you started to explain, but what do I do if I want to know if I have it and I have symptoms? That may be, it might be a cold, a fever, but if I have symptoms that are similar to a cold, a fever, or the flu, is telemedicine an option?
Absolutely, because let me backtrack. So my background, or a part of my
That's
background
not
is,
a sick cough, sorry. I just
oh, you're
coughed.
good,
That's not a
you're
sick cough. I
good,
had
you're
to
good.
drink some juice.
So I also work in the hospital, and so I see things from that end as well. And actually, there aren't enough tests to test everyone that has a cough, right? Or that has cold symptoms. And there aren't enough resources to see everyone in person that has those symptoms. So one, you don't want to be showing up to a doctor's office, ER, wherever it is, with these symptoms, and you're not going to get tested. There aren't enough tests. So we really are reserving the tests for the people that have a travel exposure, have exposure to someone that has tested positive for COVID-19. So I wouldn't want masses of people, one, wasting their time, and then two, overwhelming the ER, their doctor's office, or an urgent care by showing up with a cough. You should really be talking to someone before you present to any healthcare facility at this time. One, because you could be putting yourself at risk by being there, and two, because if you are sick, you can be putting other people at risk. If you call in or do a video visit first, we can direct you on the process, because the process, if we decide that you're at high enough risk to be tested, we will be telling you to put on a mask. We'll be telling you exactly where to go to get tested and what you should be doing to protect yourself and your family in the meantime.
Oh, okay. That makes sense. All right. I think with some of the media hysteria and like the uncertainty, which there is, especially with an outbreak like this, where it told it's 10 times deadlier than a flu. I think people hear that and then they like, well, that's everybody else. But me, I just need to know. I think there's just an element of that. But I think that solution, like with telemedicine, my other question there is that, like, if you're fortunate enough to have health insurance, how does that work? Like, do I have to pay for that? Does that work? And if I don't have health insurance, how do I take advantage of like that? Because I understand it sounds like there's clear advantages to, like you said, even if I wasn't sick, I'm going to a place where somebody is sick here. And so I'm more than likely going to leave out of here with if I wasn't sick, I got the sickness. If I am, I'm going to be around a bunch of other people. And you also mentioned there's not enough tests per se, which we've been hearing more and more. They're making more tests. And I just heard Jared Kushner, Trump's son-in-law, just got a major contract to make tests. Anyways, through his company, he just started Oscar, but that's neither here nor there. But the point there is that, like, I think still people hear it and they're like, that makes sense. But for me, it's like, I really need to be sure. I need to be healthy. But if I have insurance, or if I don't have insurance, how can I take advantage of this? Because it sounds like if I don't have insurance, most people without insurance, their only way, at least that they know, is to go to emergency room and then hopefully ditch the bill at a place that'll take people without insurance. So calling, I know doctors, your time and wisdom is what costs money as much as it is the treatments and things you can offer. So how do people with insurance tap into this? Like whether it's through RoweDocs or another one, and how do people without?
Sure. And so for telemedicine, both groups of people can benefit. So there are actually a lot of insurance companies that cover telemedicine. And for those that are uninsured or that have insurance that doesn't cover it, you can pay cash. And so usually a telemedicine visit will cost the same as a copay for the ER, right? But you can do it from your home.
So like $20 to $60,
Yeah, and so it can
or is that more?
range. It can
60
range.
to 100?
Exactly. And so it usually will range between $30 to $100, and it depends on what company you're going with and how long the visit is, all those things. But I would encourage everyone to consider it, because if you can pay what you would have paid to go to the ER and you can do it from your home and keep yourself and your family safe, why wouldn't you take advantage of that?
Speaking of which, for myself, I might need a telemedicine consultation pretty
Yeah,
soon in the next day or
yeah.
two. I got good insurance, but dude, I called the doctor. They booked up. So, anyways,
Hmm.
so actually, we need to take you up on that and see and report out to the people if it really works. But with that, no, I know it does, and I know you guys are doing well with RoweDocs. Make sure at the end again you drop. How do people tap into what you're doing at RoweDocs?
Yeah, and so you would go to our website, www.rowedocs.com, or you can call our telephone line, and I swear, I know this number, and of course I'm going to forget it now.
Don't worry about it. You send it to me. So for now, unless if you have the audio, you can say it right now. But I'll make sure whatever the number is, I put it in the information afterwards.
I have it here, and so it's 888-258.
888.
Uh-huh.
Mm-hmm.
258.
Say it again. I'm sorry.
888-258-3734.
Got it.
Mm-hmm.
888-258-3734.
Yep.
Masks.
Mm.
Masks. First of all, we both have to appreciate that how some people are learning about the severity of this is through memes and TikTok. Like our social media has turned this into a whole thing. Like, have you seen the mask off joints? Like, there's so
No.
many crazy masks on some. Are people? What are people? Because people are gonna start venturing out. I mean, people have been out. I've had to go out. I've limited. I'm not going out and moving around as much as I would normally, but
Mm-hmm.
I'm not gonna lie. I went to a comedy show on Friday. Like I had to go grocery store.
Yeah.
It wasn't. I mean, but I'm about to buckle down, and I still had a bunch of more moves to bust that I didn't.
Mm-hmm.
But so now, like these masks, they're all sold out. I'm already hearing that like they're not really that effective from stopping the virus.
Right.
Can you just please tell me what that is with the masks, and should people even be worried about masks and not have masks?
No. And so, okay.
You shaking your head.
So, yeah, people, leave the masks alone, okay? So the top thing that you can do to protect yourself is wash your hands and stay away from sick people. Stay home if you can. No, seriously. I mean, and it sounds so simple, and it sounds like, it just sounds like something that everyone would think of, but wearing the mask, to get back to your question, doesn't protect you because, one, when you're wearing the mask, there are gaps. If you look at someone wearing one of those simple masks, is what we call them in medicine, there's gaps in the side. So if someone sneezes near you or they cough near you, those droplets can still get under there and into your nose or into your mouth. And that's how people are contracting COVID-19. Ultimately, if you wanted to wear a mask, you would have to wear that special N95 mask you hear them talking about on the news. Number one, we as healthcare professionals, we have to get fitted every year to make sure we're wearing the right size. So when you're ordering, even if you try to order an N95, how do you get a size? If you don't have the right size, you're not protected. So that's two reasons not to get them. And then the third reason is, even when I wear those masks at work, and we wear them for a short period of time to interact with certain patients, you're always touching. You're always trying to make sure it's on right. you're touching your face and things are getting on it. When people talk to you or when people sneeze around you, it's getting on the mask. If you adjust the mask, now you're touching it. It just causes unnecessary issues. So the biggest things I can say are don't wear the mask. And I'll say, maybe I'll get into the last and most important reason. At my hospital, which I'm not going to name because I'm not representing them today, but at my hospital, we're running out of masks. They're hiding the
Even for
mask.
the doctors?
They're hiding the mask
From the
us.
doctors?
Yes. They're hiding the mask from staff, period, so that people don't take them away and take them home. And so on a call that we had at our hospital on Friday, they told us that we're getting low on what we call PPE, or protective personal equipment, and that includes the masks. So they're hiding them so that we will have enough to care for these patients and protect ourselves. So when you go online and buy a mask, you're now taking away the opportunity for me to protect myself while I'm trying to care for somebody.
Why don't the manufacturers just pump out more masks? I feel like everybody who's protective stuff needs to like just pump out more, and they're gonna make a killing right now.
Well, I mean, you would imagine, right? But I'm wondering if they just don't, they're not ramping up fast enough, obviously. So yeah, don't wear the mask. You're just putting yourself at more risk, and you're giving yourself a full sense of security by wearing that mask. So then when you're wearing the mask, maybe you won't wash your hands as much, or maybe you'll get closer to that sick person than you should be, because you should be 6 feet or more away from people that are ill. And maybe you're gonna go to those social things or go to the supermarket more, or whatever it is, when you should be at home performing social distancing. Because people, like you said, you know, everybody's really trying to gauge, how serious is this? Should we really be afraid? And if you look at what's happening in Italy, it's Italy. They're not a third world country, you know, like they have the same kind of resources we have, and people are dying over there. So I would pay attention and just, you know, I know Dr. Fauci, I saw
Yeah.
that.
Please reassure people on that, because you're hearing like now the internet rumors are going crazy. The news rumors are going crazy. I don't see people dying because we're in a much more visual, like for better or for worse. Even I think this is across not just young people. This is young people our age, middle age, older generation on down. We've transitioned to such a, if I can't physically see it, I'm really not going to believe it, because even now with deep fakes and the internet and technology, even when I see something, it could be doctored. But at the least I need to see it to hear it. So I feel like we hear about Italy and hear about numbers, but it's just like, in terms of the visceral effect of like, this is coming here if we don't do this, because it's not, we're not seeing videos and pictures and photos of dead people piling up. There's been a report in Iran, maybe digging a mass grave and giving misinformation. God knows we're not getting nothing out of China that they don't want us to have. So it's hard to trust and know and definitely not getting images of like how deadly it is in all these other places. And I think part of that, the lack of visualization of it, I still think has not impressed upon everybody to move a completely different way. I think luckily a lot of, from now the federal response has gotten there, but a lot of governors, a lot of mayors, a lot of private sector and business people have like immediately kicked in the office and like, at the very least, let me get people away from each other and start doing different things. But it's been, I don't know, it's been very interesting. What about this fever thing? Because I don't have a thermometer. So how am I supposed to check if I have a temperature?
Get a thermometer.
Somewhere. If you think there's thermometers in these streets, you crazy.
Yeah. I mean,
Right. I just went on Amazon yesterday. They were like 2 weeks. I'm like, damn. Amazon Prime 2 weeks.
Well, I mean, ultimately, if you have concern that you have a fever and you really have no way to check, that's where we're saying if you have any concerns, call your doctor. If you have any concerns and you're calling your doctor, you can't get them, book a telemedicine visit. Like, get in contact with someone that has the knowledge to guide you. And so don't let fear cause you to run into your doctor's office or the ER. Um, the biggest concern that we have is that our healthcare system will be overwhelmed by this, overwhelmed either by really sick people or just by a multitude of people in general coming at the same time. And if we're spreading our resources thin, caring for people that should have called in, it leaves less time to care for the really sick people. And so we really have to be careful and be mindful of how we should be managing this.
Another question, as it relates to this, is that, well, another question that comes up, I think that, and somebody asked this, and I'm trying to make sure I fit this properly, is that how long do I need to be this vigilant? Because it makes sense if we do it for 2 weeks, 8 weeks is a long time. Maybe even a week is a long time, but 1 or 2 weeks. But now you start talking about I need to be vigilant for 8 weeks. The CDC is issuing no gatherings of 50 people more for 8 weeks. Some schools and businesses, and it's like, at least the way I would say my logic, people logic might go is like, all right, well, 8 weeks. What if people who still have it then get back? We all start popping and going outside. Next thing you know, everybody gets it again. Like, how long do we need to change this massive behavior? I think one thing we should all pick up is better hygiene moving forward as a society, as a global and an American society. So let's start there. But this real thing about social distancing, staying away, no gatherings, like our economy would shut down if we had to do that, like in perpetuity or for a year, even 6 months. I think 2 months is going to change. It's going to fucking change the game. Like the Democratic presidential nominees are talking about that right now. The economic fallout is going to be crazy. But me at home, how long do I need to safely be distanced from people before I can like go back to some semblance of my regular life?
I think honestly, nobody knows, right? We really don't know. And so I know, right? Ah, we don't know, right? Because we're at the very beginning of this. And because of the issue with testing, we genuinely have no idea how many people are carrying it and passing it along. We have no idea how fast people are going to start dying in this country because of it. And so I feel like we started out with the 2 weeks. And then I know a lot of school systems are saying now they're going to have the kids out for 2 to 4 weeks. You know, I do feel like within a month's time, we'll have a better idea of how this is all working.
What's going to change in that month? What's going to change in that month that will make us have a better idea? Just more people have gotten tested? Is that it?
I think it's multiple things, right? Because I know, and I was bringing him up earlier, I know you discussed him briefly with Dr. Llanos. Dr. Fauci from the CDC has talked about this whole bell curve and what they're saying about how many people are dying, how fast this is being spread. And we talked a little bit offline about the epidemiology and what the epidemiologists are saying about how many deaths there will be, and that there could be over 1 million deaths or something like that. But we have the power as a community to change that, right? So if everybody keeps going to the movies and to the mall and to the comedy club, you know, then maybe we will be in that worst case scenario situation where there's millions of deaths. But if we practice social distancing, this is a real thing. If we stay at home for a few weeks, maybe we can be at the best case scenario statistics where there are a lot less deaths and a lot less cases. And in addition, it will provide the opportunity for the healthcare system to be less overwhelmed. Like there's a finite number of ICU beds and a finite number of breathing machines. And in Italy, they're having to choose who gets the breathing machine, you know, based on your age, based on what chronic illnesses you have. They're choosing who gets a chance to live and who dies from this because everybody can't get all the resources. So if we have the power to change the paradigm by staying home for a month, I've already canceled some trips. Like I've canceled
See,
trips.
these are our first world problems of people who got good paying jobs with insurance that are salaried employees and or we're if you're contracting enough to where I can make that money. I think staying home for a month, just off the top of my head, the moment you said malls and places, play this scenario out. So now we stop going to malls. Either the malls are closing down or no one goes. That means every store in the mall, they all have mostly hourly employees. They all either going to get all their hours cut and or get sent home. And if they're small business, small places, they might not even be able to sustain for past a month, or when it does open up, it's going to be such a slow trickle effect. Like, and that's just dealing with the mall, the ripple effects of the mall. So it's like, I think that it's just scary to not have to go places. But if that's what we need to do to stop this so people don't die, and then I think the other part is like people are always going to, until I think it hits home and they start seeing people they know get it, it's going to like, oh, how do I feel? Or if they see when people start spreading that not 10 or 20 people die, but a couple thousand people die, if that starts stacking up, I think that's, unfortunately, that's what I feel like things have to get to. Like it has to reach home. Because at the most, if I just see like a bunch, if I don't even see people get sick that much, except for on TV, it's not going to be as real to people. Which
well, I'm already
sucks.
seeing
So
people get sick.
But you work in a hospital.
Here, but I'm just saying, like, but do you understand what I'm saying? Like, in this short time, it's like at first, if you look at the numbers, like we have almost 3,000 cases here now. And even a month ago,
in the U.S. though,
right here in the U.S. And
but there's 350 million people here.
Right, but all I'm saying is, if you look at the trajectory, right? Because a month ago, this was other people's problem, right? And the number of cases that we have here was a fraction of what we have now. And so, like you said, for some people, it's hitting home for me because I'm seeing it. So I'm just trying to spread to other people that it is real, and there are people that are very sick from it. So,
man, it's impactful in a whole nother way. What would you suggest? What would you suggest, or what information should people be sharing? Like, this is a sharing economy. I see a post. I see it's on. I'm gonna post it on Twitter real quick. I'm gonna post it on Facebook. There's been all these mass text chains going around about. My friend worked in the government. I actually do have people in the government, so it messed it up because I did send some people a few texts on Friday that I said not to be alarmed. This is what I'm hearing, and these are from trusted sources. But now I'm getting that reverberated from several different people, like getting mass text chains, and then these are the ways you can test. Oh, are you familiar with this text that's going around that said in China, or the Japanese way to test for the COVID virus is hold your breath for 10 seconds if you can do it without coughing? Is that true?
No. I have not heard that.
Do you know what I'm referring to? Do you know what I'm referring to?
No.
Do you know what I'm referring to?
Mm-mm.
You haven't seen the I'm Googling it right now real quick. There's a there is a right now, don't hold your breath. There's this thing. Oh, okay. coronavirus warning about fake claims that holding your breath works as a self-diagnosis. You haven't heard about that?
You know,
There was a
I've been at work all week, so I haven't been on social media that much.
Well, it got around on social media and it got around through mass text chains that's saying that the way to fight against or self-diagnose on corona is to hold your breath for 10 seconds. And if you can do it without coughing, that's how they're at least getting your idea. I don't know. I'm saying the information out here is nuts. And everybody wants to know where I am. And then the other part, can you talk about how just because you test negative once doesn't mean you'll never get it?
Right. Yeah.
No,
I mean,
explain that process, because it's not like, it's like, I guess for lack of a better term, it's like getting an HIV test or STD test. You're good at that up to that point. But then if you go have sex again, if you go have sex again, you need to get tested again.
Right.
It's like, because people a lot of times take their STD or HIV test like, yo, I'm good, I'm free, I got tested 2 years ago, or I got tested last year. It's like, no, bro, but I didn't have sex with 6 people since then. It's like, dude, you need to get tested again. The moment you step out and go do some other things, that's like having sex again. Like you are now. Am I wrong?
All over again from the beginning. Yeah.
Exactly. So what about that? The idea of like people needing to get multiple tests.
Again, there's not a lot of tests. So most of the people are not getting tested to begin with. But if you have a fever, you have a cough, you feel short of breath, then you need to be concerned. If you have been in contact with anybody that's traveled to any of those high-level places, like China, Italy, Iran, Europe, period, at this point, you should be concerned. If you've had contact with somebody that tested positive, you should be concerned. And in any of those,
that's the thing. I think very few people know anybody who tested positive, because very few people have been able to get tests. But I've been in contact with people who now say, "Oh, I feel a little sick," like in the last 2 weeks. So it's like, I don't know. Like, I don't know.
So
I don't know what's the smoker's cough and what's the real cough.
Say that again.
I said, people don't know one of my friends who's a smoker, he's like, I don't know if this is a smoker's cough or a real cough. Like, it's like people just don't know what to think. I mean, that's real.
Right. It is. And at this point, because there's community transmission, and you can get it from somebody that's from the US at this point, right? So if you have a cough or you have a fever or shortness of breath, then you're supposed to be staying at home. You're supposed to be staying at home. You're supposed to be calling your doctor or somebody in the medical or healthcare profession to say, what should I do next? And if you have the opportunity to telework or quarantine yourself at home for 14 days, that's what you're supposed to be doing. And you do what we call self-monitor. There's all these different levels of what you're supposed to do. So if you're
Can you break those down? Can you break down the self-monitoring levels?
And so I'll try to remember it all, but basically self-monitoring is if you have those symptoms, but you haven't had any contact with a high-risk person, then you just stay home and quarantine yourself, basically. Don't go around other people, other than the people you live with, obviously. If you have those symptoms and then you've been in contact with someone that has traveled to other places, any of those high risk places that I mentioned, then you're supposed to stay home and check your temperature twice a day and obviously contact a healthcare professional. If you have any of those symptoms and you've been in contact with someone that's COVID-19 positive or is being tested for it, then they will refer you for testing. And they'll tell your healthcare professional will tell you where to go, or you can call your Department of Health. So there's multiple opportunities or resources for you to tap into to figure out what to do. And then the last piece that we didn't discuss is if you have any alarm symptoms. So if you're feeling very short of breath, you have chest pain, you're getting confused, those kinds of things, you do go to the ER. If you're having alarm symptoms, in addition to your fever and cough, you should go to the ER. Mhm. And they will
You
help.
mean alarm? What is an alarm system? But that could be anything, right? Like you're saying, if you have shortness of breath, then you should go to the ER. Period.
Right, exactly, exactly. But for people that were concerned with the fever and the cough, and they weren't sure what to do, if you develop shortness of breath, chest pain, confusion, then you should show up to the ER. Because I know there's that gray area, right? I'm not feeling well, but should I call in or should I show up? And those are reasons that you should be showing up to the ER for care.
Go, go. Well, thanks, Tiff, Dr. Turner.
Yeah.
You've given some really good advice. You debunked a couple myths. Once and for all, can Black people get corona
Absolutely.
and
Absolutely.
COVID-19?
All of it. Yes. If you're
Okay.
human, you can get it.
It's one of the wildest internet rumors. I knew Black people living by that meme for at least 2-3 days. Like, man,
Yeah,
we
no.
good. Our melanin,
Yeah, no.
the melanin stops it. Like, what?
The melanin is
Uh,
rich now, but it doesn't stop COVID-19.
okay. Man came up with something that even can't stop that. Well,
Mhm.
this is the Hip Politics Hip Hop Podcast, and we normally do. We end every podcast with the top 5 dead or alive favorite artists. But in light of what's going on here with this COVID-19 illness, the coronavirus outbreak, all the confusion and so forth, what could be helpful from a doctor like yourself and a person who's deeply entrenched to this? What are your top 5 ways to stay alive
Okay.
during the corona outbreak of 2020? Top 5 ways to stay alive.
Okay, I'm gonna try to stick to 5. So, top 5: wash your hands, please. Wash your hands, okay, before you
How
eat.
long do I wash my hands?
20 seconds, okay? It's 20 seconds. And they say if you sing happy birthday twice, that's 20 seconds. It seems like a long time, but it'll help keep you safe. So wash your hands before you eat, after you go to the bathroom, before you touch your face, wash your hands.
Okay.
After you blow your nose, wash your hands. So it goes on and on, but just wash your hands. So the next thing would be social distancing. It's real, it's important, and it can help save lives. It can help save your life. And so just stay at home. Like if your kids are at home and you're able to telework, just stay at home. You should only be going out for essential things like getting more food. If you, what else to say? If you have to go out, basically avoid crowds and definitely avoid sick people. So if you see anyone sneezing, coughing, make distance between them at least 6 feet. So the third thing
Back. Give me
yes,
50 feet.
yes, please.
Top 3. So wash your hands 20 seconds. Happy birthday. Say happy birthday twice. Social distancing 6 feet. Stay away from as many people as possible. For how long? How long are we staying away from people?
For now, at least a month. Let's see what other information we get. Let's see what other information we get as this develops. What else can I say? If you sneeze or cough, do it into your sleep. Yeah, and so you should be doing this, not doing anything towards your hands.
Okay. So now I got corona on my sleeve, though. Then.
Yeah, but who's touching your sleeve? You touch everything
I
with your
am.
hands.
I do like this. I walk around like this all day. No, I'm just
So
kidding.
if you do that, wash your hands after you walk around like that. What else to say? Things that a lot of people touch, try to use a tissue. Like if you're opening doors, use a tissue to open the door. If you're turning on the faucet to wash your hands,
Wait, right there. With
mhm.
tissue, isn't tissue a porous thing? So can't the coronavirus like seep through the tissue and stuff like that, or is that not how it works?
There's a barrier, right, between your hands and the surface. So use a tissue, or after you're touching things that other people touch, wash your hands. If you can't wash with soap and water, which is the #1 way we recommend for you to wash your hands, then use the hand sanitizer. What else can I say?
A good fifth one.
Oh, yes. And we touched on it a little bit. If you feel sick, call your doctor. Do not show up without calling. Do not show up to any healthcare facility other than the ER with alarm symptoms. If you feel sick, do not show up anywhere. Call first. The only reason you should be showing up without calling first is if you have alarm symptoms, chest pain, shortness of breath, confusion. Okay, so I think those are my top 5.
Got it. Top 5. Number 1, wash your hands 20 seconds or more. Say happy birthday twice. Number 2, truly keep 6 to 8 feet social distancing. Minimize your contact for at least the next month, as much as humanly possible. Take that super duper seriously. Third, is that you should say call into your doctors. Third one was call into your doctor if you have alarm symptoms. Don't just show up. The only place you show up with alarm symptoms, which is shortness of breath and extreme coughing and other things, I'm assuming, like things that are like, hey, I'm really, really sick, is to an ER. What else what were the other 2?
I said cough and sneeze into your elbow or
Cough and sneeze
sleeve.
into your elbow, into your sleeve, not on your hands, to what prevents you from getting on your hands, and your hands naturally spread stuff. So sneezing, if you are going to sneeze in public, sneeze into your sleeve.
Yes. Mm-hmm.
And all right, soap is better than hand sanitizer.
Mm-hmm.
Got it. Well, Tiffany, Dr. Turner,
Yeah.
thank you, friend. Thank you, friend. Thank you, professional. Thank you. Continue the good work. I know you guys are on the front line of the coronavirus war, and will be for quite some time right now. Thank you for being. Thank you for just even your demeanor and being calm, because I think part of this is naturally ramping up so many fears that just because. Not saying I'm not freaked out, and like I have people who are close to me who said they have symptoms. Nobody's been tested, but have symptoms of either a cold and or the flu. Every time I randomly cough for whatever reason, like I just had whether it's a tickle in my throat or water, is drinking water the wrong way. Like for the last week and a half, I'm on edge.
Mm-hmm.
It's hard to even concentrate with all of this on work.
Mm-hmm.
Like I think the mental health effects are going to be so damaging. Let alone, I thank God I work for a company that we are good. Like we're working from home, and we're gonna like my paycheck's not about to stop. Hopefully, it'll be impacted. But there's so many people that I know that is a real reality. Like my friends who are Uber drivers and stuff like that, they're fucked right now. So
Yeah.
it's kind of like when you pull this out of the economy, you realize like how fragile our whole system is. So this is the time of anxiousness, and I think projecting a sense of calm is that not saying things aren't going to get bad or aren't bad, but it's like they're manageable, and we will figure this out. And I think getting that, I mean, despite Agent Orange in the office and all his trumpery, we still individually can like really kind of pull through this. And I think it's just very important, very important. And I appreciate you taking the time, taking some of your knowledge. Thanks for also being a friend and like even responding, because I've felt
Of
I had
course.
the idea to hit you a day before, and I was like, dude, she's probably so swamped with stuff right now. I hit Letitia. Letitia didn't hit me back, so I was like, I know she's busy.
Oh, yeah.
Uh, and she got a whole son, so she got to make sure her son is straight too. But tell her what's up. Can you just before we go, drop your information that you want, like how people get in contact with you or the RoweDocs?
Sure.
I think they said telemedicine is great, so just drop the website and the phone number again for
Okay.
people who are hearing and understanding this.
Absolutely. So it's www.rowedocs.com. For emailing, you can contact us at info@rowedocs.com. And phone number 888, and now I gotta look at it again, 888. Do you have it there?
No, I'm gonna hold. Get it right, because people listen to this.
Phone number 888-258-3734, and it's twofold. If you're a patient or you're a person that has questions about this, wants a video visit with a board-certified physician, you call that number to make an appointment. If you're a physician who's trying to add telemedicine to your practice to help service your patients, you can also contact us to help add that to your practice.
Dope. Well, thank you. Again, this information will be up on the Hip Politics and the Hip Politics podcast, all of our Facebook, social media. Tiffany, thanks for taking the time. I really appreciate it. This was a really cool experience. Thanks for working through the technical part of it. Again, you and Dana, Dr. Llanos, yesterday. Thanks. See, that's that Howard coming through, Howard alum. We're everywhere. And really kind of doing our thing. People are doing their thing and really on the front lines of a lot of these issues. So thanks for sharing that knowledge and helping the community out a little bit better. Good luck these next several weeks or however it is, working overtime, serving the people. You stay safe.
Thank you. Same.
Yeah, as much as you can, maybe. If I was a real hustler and I had the supply chain, boy, oh boy, I'd be making masks, gloves, something. Because I know people would, I'm a real hustler, I just don't have that supply chain. But I'm like, dude, it just would seem like, just make them. Like, people are going to care about this at least for the next several months.
Yeah.
So you gave a lot of good tips around the masks, around washing your hands, and how to sneeze, how this looks, how to get in contact with your doctor. I appreciate that, and I know the people do too. So with that, and your top 5 ways to stay alive. That was a cool little flip on that. So with that, I want to thank all of our listeners, all our viewers, all of our subscribers to the Hip Politics podcast. Again, stay calm, stay safe. There's some information here. The CDC is giving out good information. Just practice common sense. It starts with hygiene. That's the number one thing everybody says. So that's things that are within our control to start with better hygiene. So with that, this is another episode of the Hip Politics podcast, and we are out. Bang. Bang. Shorty,